Our kidney filters blood from toxins, but because of high blood pressure, high glucose level, our kidneys are damaged over time, and it affects around 30% of world population after age of 50. It means kidney damage is very important and very common problem. That's why we will talk about 10 tips how to improve our kidney health. First is control blood glucose level. Why? Glucose is toxin. High blood glucose level causes accumulation of free radicals, and these free radicals damage DNA of kidneys. Kidneys have very fine, very delicate structures, very delicate blood vessels, and it's very easy to damage such small blood vessels. It is called nephron, which filters. Actually, these small many blood vessels are filter of our kidneys, and these free radicals damage them. That's why high blood glucose level is huge problem. What is solution? Solution is maintain stable blood glucose level. How to measure? It should be measured by glycated hemoglobin. Glycated hemoglobin in the blood should be less than 7%. It means that glucose is stable previous several months. That's why glycated hemoglobin measurement is very important. And how can we know that kidneys have problem? What is the most common test? Most common test is creatinine test, blood creatinine test. If creatinine is elevated, it means that our kidneys are not functioning well and is unable to filter blood properly. So high creatinine is waste product in our blood, and it should be filtered. If it's not filtered and if it's elevated, it means that we have kidney problems. Second, you should control your blood pressure. Why? Because constantly elevated blood pressure also damages these delicate structures of small blood vessels of nephron, of kidney. That's why it can damage kidney directly. When blood pressure is constantly elevated, small blood vessels are damaged, and chronically over time, gradually, this damage is gradual and progressive, and eventually kidney failure happens and person requires dialysis. That's a huge problem. That's why what is optimal blood pressure? You should keep your blood pressure under the 140 top measurement, and below measurement is low measurement is less than 90. That's optimal blood pressure measurement to keep for your kidney health. 3 is reduce salt intake. What is the recommended salt intake for people who has kidney problems? It's 1.8 grams per day, sometimes even less. If possible, even less. If person has advanced stages of chronic kidney disease, then less than 1.8 grams of salt intake daily is recommended. And 4 is kidney-friendly diet. First, let's say what you should not intake. You should reduce intake of food with high in sodium. Such foods are processed meat, hot dogs and bacon, or canned soaps and vegetables, chips and pretzels. Why we don't like high sodium? Because they blood pressure, and increased blood pressure further damages kidneys. That's why we should avoid food with high in sodium. Also, we should avoid food high in phosphorus, because when kidney is damaged, it unable to filter phosphorus effectively, and phosphorus are accumulated in the blood, and it can damage joints, and it can increase the risk of heart disease. That's why milk, cheese, yogurt, meat, nuts, seeds, beans, lentils, these foods are high in phosphorus, and person should minimize or reduce intake of such foods. And potassium rich foods is very important also, because for kidneys it's also difficult to filter potassium, and for intake foods with potassium can cause heart problems, including arrhythmias, and sometimes this arrhythmia can be uncontrollable. And potassium rich foods are like bananas, dried fruits, citrus fruits, and nuts. And now, what to eat what is kidney friendly foods? Which are kidney friendly foods? Such foods are apples, berries, grapes, pears, watermelons. From vegetables, bell peppers, broccoli, cabbage, cauliflowers, whole grains can be in moderation, and poultry, fish, avocados, and olive oil. And 6, weight loss. Weight loss is very important because being overweight further damages kidneys and increase risk of many complications, include heart disease. So weight loss is very crucial, very important step to maintain healthy weight. It's very important, actually. It's one of the most important steps for kidney health. And 7 is avoid non-steroidal anti-inflammatory drugs such as ibuprofen and naproxen can further damage kidneys. That's why, if possible, you should avoid anti-inflammatory drugs. But of course, you should not stop intaking important drugs independently. You should ask your doctor first. And avoid excessive protein intake because metabolism of protein creates many toxins in the blood, and these toxins sometimes is not filtered effectively. That's why toxin can be accumulated in the blood. That's why it's recommended to avoid excessive protein intake. And what is optimal intake of proteins? If person is around 140 pounds, for example, for such person optimal intake of protein will be around 50 grams per day. Sometimes if there is advanced stages of kidney disease, can be less, even 40 grams, for example, per day. And 9 is stay hydrated. It's very important also because when you intake water, you flush out many toxins from your body, and hydration is important for normal kidney function. And aim for 2 liters of water, including coffee and tea. And here's common questions that if coffee and tea are safe for kidneys. They generally consider safe for kidney, but you should remember that coffee temporarily increase blood pressure. So if you have blood pressure, maybe coffee is not recommended for you, but generally they consider safe for kidneys. And fruit supplements have some evidence, some background that they have a protective effect on kidneys. Such supplements are vitamin D, omega-3 fatty acids, curcumin, sodium bicarbonate. Sodium bicarbonate is baking soda. So why they are effective? Vitamin D is important because many people who have kidney problems have also vitamin D deficiency, and it's crucial for bones. It's crucial for stable blood pressure. That's why vitamin D is important for such people. Omega-3 fatty acids have protective effect on the kidneys. They can slow down progressive of disease. In case of chronic kidney disease, they can reduce protein in the urine, so they can improve some degree kidney functions. That's why omega-3 fatty acids is also important, because they reduce inflammation, because they have antioxidant effect, and they can neutralize free radicals and protect nephron and protect kidneys. And curcumin also has anti-inflammatory and antioxidant effects. That's why curcumin is effective also, but these findings are inconsistent and require more research to confirm these findings. And sodium bicarbonate can neutralize acidity. This acidity is caused by impaired kidney function, and sodium bicarbonate can neutralize this acidity. That's why it can have some effectiveness also if person intake it as a supplement. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my video, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.